This time, though, I'd like to introduce Congressman Brad Miller.
Thank you. Well, thank you. I am the child of two public employees, so I take it kind of personal when I hear folks in politics say that all government is bad, you can't do anything right. I know both my father and my mother worked very hard and gave the taxpayers their money's worth, and I think all of you all do too. I was very pleased to represent Lake County in the state Senate for 6 years and represent a whole lot of state employees. So I appreciate what you do, and it's something I value. It's something I saw my parents do as I was growing up. This is a difficult time in our politics. I mean, we've had 30 years of the country moving in one direction, of letting business do more and more the way they want to, and we've seen the result of that. We saw it in the financial crisis, in the mess on the financial side. We've seen it in the collapse that came from that. We may now have hit the bottom, but it's been a tough 6 months, really a tough couple of years, and it's not going to turn around and go right back. It's going to be tough for a while. The main thing we need to do is make sure that never happens again. Fix the things that we should now know are wrong, and it's going to be a bitter fight because the people we have to go up against are very powerful. They've been making a whole lot of money doing things the way they're doing them, and they sure don't want to change that. On health care, I don't know how much clearer it could be that we are not getting our money's worth from our health care system. I agree that we've got the best health care in the world. We've got the best doctors, the hospitals, we've got the sophisticated technology, and we are 45th in the world in life expectancy. Now, we may have good health care, but a lot of Americans aren't getting it. And we're paying way too much. We're paying twice what other countries like ours, with prosperous economies like ours, are paying for health care. And Americans don't live as long, and they're not as healthy. What we're doing now, I know a lot of folks think that we ought to do what Canada does and just have and say that the private health insurance companies simply can't be trusted. They're always going to find loopholes. They're always going to find a way to game the system. And having employers pay health care costs is bringing us down generally. But what we determined to do is try to work with what we've got, try to put rules in place on private insurers that don't have those rules now, rules that really aren't even as strict as what North Carolina puts on car insurance companies. We need to know exactly what's in a policy, what gets covered. So you don't find out what kind of coverage you really got only when you get sick, when the doctor has given you a really scary diagnosis, has told you something scary, and then you spend 2 or 3 days in voicemail hell trying to figure out what your insurance company is going to really pay for and what they want. And people, if they lose their job, or they get sick and lose their job, they may lose their health care when they need it the most, and they may never be able again to get coverage for what they're most likely to need coverage for, to be treated for. So something's got to give. We've got to fix the system, and we've got to get everybody into it. It just can't work any other way. You all have been stalwarts of standing behind us, being part of the debate. I know that SEIU in Washington has gotten death threats. I know how it feels. And I appreciate the support that you've given. You've got to keep doing it, and don't just turn out with banners and scream. You need to be persuading the people you come into contact with every day. Saying that the things that the other side is saying are just plain crazy. And then next year, you've got to be there when we put all this to the test and we go back before the American people. So I'm happy to take a few minutes of questions about health care or any other issue that you all got.
Congressman Miller, when these insurance companies make a great deal of revenue, who really oversees the profit margin that they make?
There isn't. I mean, if they can make profit, they get to go ahead and make it. Now, the way supposedly the economy is supposed to work is if we've got 1,300 private insurers, that the competition should force prices down. But it doesn't because every plan is different. People don't know how to compare. They don't know what they're getting. And the way insurance companies make their profit is by cherry picking, by trying to design policies and ways to market their policies that only brings people into their health care, into their insurance, who are least likely to get sick, least likely treated. And they're, some of those health insurance companies are saying that they're willing to give that up now, but at the same time, they're funding some of the crazy opposition. So I don't know what to believe. But I'm not inclined to believe them.
I will ask a question if I may.
Sure.
And that is that, President Obama at one time said that if he had the chance to start over from scratch
Right.
and design a brand new healthcare system for America, he would go wholeheartedly with a single payer program. We know that there's a lot of people out there that cannot afford, and people even maybe some scenic members in here, or their families that cannot afford healthcare insurance. Do you anticipate when the final bill, and I know there's no one bill right now, but when the final bill comes together, do you anticipate and will you be fighting for at least some type of public option?
Yeah, and the reason for public option is to control cost. That if in addition to those 1,300 private insurers out there, there is a government-sponsored, organized health insurance plan that offers insurance on the same terms, the same kind of standard benefits package, that isn't subsidized by taxpayers. It really is supported by premiums, and doesn't exclude people based upon their medical history, and nobody else is supposed to do that either. If insurance companies know that Americans can drop them like a bad habit if they don't provide good insurance, they don't provide proper care, or they're too expensive, it's going to keep them all honest. And that's what the public option will do. And sign me up. If I have the chance to choose the public option, that's what I'm going to pick for myself. I don't want the private insurance companies to make a nickel off of me. I would rather have the public option than have it with a private insurer. If I get really sick, I don't want someone deciding about what's going to get paid for who's making a profit and is thinking about their profit. And if they deny it, they make more profit. And Americans on Medicare, which is a government health insurance program, Americans on Medicare like their insurance, like their health care, better than Americans on private insurance. So the lesson I draw from that is I'd rather be on the public option than have private insurance.
Across the nation, Congressman Miller, a lot of people, you see on TV and everywhere, they're arguing or whatever, and apparently they don't have the right information. What are you guys doing to disseminate the right information out there to the
Well,
people?
some people don't want to believe the right things. I mean, I think a lot of it is very intentional. A lot of it's on email, so you never get at it to say that's not right. The idea that we're going to euthanize people, old people or people with disabilities, is just wild. I mean, that's howling at the moon crazy. There is no basis for that at all. The only thing in the bill, there's nothing about abortion in the bill at all. But the only thing in the bill about treatment for people at the end of their lives is a provision that allows doctors to get paid, and a lot of them are doing it now as volunteers. They know it's something their patients need, and they're doing it for free because they're not getting paid. But I've had friends, one good friend, who got a terminal diagnosis. And we all know we're going to die, but having a doctor tell you it's going to be within the next 3 months is something we'll do. And it was a great comfort and a great help to my friend and his family to get end-of-life counseling from his doctor. A lot of people, when they get a terminal diagnosis or when they're in old age, last years of life, get very depressed, and counseling helps them through that, and it helps them know what kind of decisions they need to make. Americans know that happens all the time now, and it's the right thing to happen. People do need to know what they need to decide, what decisions they need to make about how they get treated and what decisions they need to make. And that's all that's in there. Now, they're also saying that this is somehow communistic. It's all it does is regulate health insurance, and it regulates health insurance. It sets rules for health insurance that aren't even as strict as what North Carolina has for car insurance. Now, I've never heard North Carolina called